All right, welcome back to the program. In case you're just joining us, it's time for our conversation now. At the beginning of the program, I did say we will be looking at health security. Is prevention better than cure? Or perhaps in Nigeria, it's the other way around. Cure is better than prevention. But should we also begin to, tailor the concept that perhaps prevention is cost-effective than cure? We shouldn't be running helter-skelter when there's another epidemic that I must tell you it must come. I'm not the devil's advocate or a voodoo woman or whatever, but societies prepare for epidemics. Seun Onigbinde is here. He's the co-founder of BudgIT, as well as Serah Makka-Ugbabe. I hope I got that right. She's the country director of One Campaign. First time of their being on the show. Is it? Yes, in AIT, actually. Should I clap?
You should.
Welcome.
We're glad to be here.
Thank you.
Welcome, guys. Seun, how are you?
I'm fine, I'm good. I mean, I'm glad to be here. I mean, this is my first time in AIT.
Yeah.
I was also in the studio. I mean, I know we're like 4 or 5 years.
Yes.
We should have loved to do this.
Yeah.
So, I mean, this will be the first, one of many first.
Yes.
Yeah.
And I must say congrats. You know why? Why I'm telling you congrats is on BudgIT.
Yeah, great.
I remember, perhaps I was one of those people you shared that idea with.
Yeah, but I mean,
years
ago.
Yes. In Lagos.
In Lagos, I mean, in our house in
our house, we
Shomolu.
were in Lagos.
And see how much it's grown.
I'm telling you, so when I see Seun, I'm like, this is what is called a Nigerian dream.
Yeah.
That we should begin, whatever it is, there should be a Nigerian dream, not just an American dream.
Yeah.
And I'm so happy for you, Seun, because
Thank
I
you so
remember
much.
when you shared the idea of BudgIT with me, I just came back from Sierra Leone. That should be like 2012 or so.
Yeah, 2011,
2011, yes.
Yeah.
I came back from Sierra Leone that day and we were like, yeah, my younger brother, you were trying to explain, this is what it is. I was like trying to catch up with what you were saying.
Yeah.
But congrats, Seun,
Thank you
with what you've done.
Thank you so
And
much.
you know what I
Nancy.
love about BudgIT as well is that it solves a problem.
Yeah.
You know, budgets are not the most sexy topic.
exactly,
No,
yeah.
BudgIT has been able to captivate our attention and help us to use that to actually do things in Nigeria.
Yeah, that's great.
So let's come to our conversation
Yeah.
now. We're looking at the preparedness, or perhaps preparedness of fighting epidemics. Like I said earlier, they will definitely come. I have a science background, so perhaps I'm also speaking professionally now, even as a disease expert, you know, that we will definitely see
Absolutely.
epidemics, whether we like it or not. We've seen, is it Ebola? We've seen Lassa fever. We've seen, I think, yellow fever,
Monkeypox.
monkeypox, and all of that. Seun, let me start with you. Why is it necessary, or perhaps why is it a good investment to prepare than throwing money at disease events when they occur?
Okay. I think the first thing you have to look at when we say health security, which is the way you couch it, as a country and as people, we try to apply reactive measures to everything. And in the end, because when emergencies happen, we don't have structures to even manage them. We find out that we, in our own view of BudgIT, either when it was flooding or either way where it was Ebola, we find out that we spend so much with so little accountability. And so there's so much wastage. And you're even trying to jump all the rules. You're trying to say, okay, we can't go through a 45-day procurement cycle. We need to get this going now. So we're seeing all that space. But I feel like prevention for us is about saving money, it's about saving lives. And because you also don't know the scale of what it could be. Look how very lucky we were with the Ebola. I mean, in terms of the guy coming in through an airport, he could have just walked through a Benin Republic border, and before you know, he fell down in Orile, and then 100 people tried to touch him and say, oh, this is what happened. And so in terms of the way that we need to think through more about, we want to save more lives of Nigerians, and we also want to save much more money. Because I see that times when things come up in emergencies where we have not prepared, there's so much wastage, there's so much corruption. You think that people are trying to solve the problem or trying to mitigate the issues, but everybody's trying to still make much more cuts for themselves. And that's the way I see it from a fiscal prism, that it's better we put structures in place to prevent issues. Things from happening.
Sarah, you want to come in there?
You know, one of the things about epidemics is that it really takes away all the gains we make on economic development, our GDP growth, trade, tourism, foreign direct investments. We saw what Ebola did to the countries of Liberia, Sierra Leone, how much their GDP fell.
And they've not recovered.
And they've not recovered. So what we're trying to say is having a response to the epidemic before it happens actually saves us not just resources, but also our own future, right? So how do we set up labs in states? How do we address cholera, smallpox, monkeypox, Lassa fever within states today? So tomorrow, we're not, as Seun mentioned, running helter-skelter, reactively. We're responding proactively.
Yeah.
And I think that's really what we're here to talk about. How do we proactively respond to these things today?
Why do you think we're not having that proactive response? Why are we always reactive? Not just even with this. Do you understand? Perhaps it's most of what we do as Nigerians.
You know, the healthcare system, you know, is a derivative of the function of a society, how functional society is. For example, look at our primary healthcare system. And if you look at Ebola, either in Guinea or in Serah, in Liberia, you find out that most of the outbreak started from the rural areas, mostly border towns. And so the collapse of primary healthcare system in those places, you know, excavated the whole crisis because nobody's diagnosed, nobody's checking. We were even lucky. Why I say we were lucky is that it wasn't a primary healthcare system that conducted the first diagnosis. So there's a bit of containment you could have. And that's why investing in health security, like your primary healthcare infrastructure, your personnel, investment in the personnel, investment in drugs, investment in diagnosis, and now you even have escalation systems. These are very, very helpful because I feel that health infrastructure bit is the first level of securing the health of the country. I mean, in terms of making sure that you mitigate the crisis. Then you can now do a second level, which is now where you come into the disease control. How do you, when things escalate and you don't, it gives you a strange symptom that you practically don't understand, how you build a system, a containment system that you can then lab samples and you can say, okay, it is, you know, yellow fever, this is Ebola, or this is something, a form of strain that we have not seen at all, and we need to get other experts to take a look at it too also. I feel that we need to take it on both sides. Firstly, taking our primary healthcare system serious, which we grossly underfund, you know, and second is to now take in also the disease control and the disease management center and properly invest in that. We look at in the 2018 budget, less than 300 billion, around 206 billion, was released as capital expenditure for even the National Center for Disease Control. So, you know, in a country of 180 million people, what exactly would that do? 206 million, not billion, million. You know, what exactly would that do? I mean, and the whole health budget for the country itself, I mean, by the time you even add up, especially for even if it's the federal government, it's less than 400 billion. And so if we don't put much more work, you know, on primary health system, if you diagnose, if you look at education, if you like advanced countries, I mean US, UK, you ask what's the biggest component of their budget? It's either it's for its defense, definitely. Security goes in there. Education
Health
and health. That's what that's the
things
first
around HDI.
those are the first primary roles of government. But we are using more of public taxes and public revenues to fix infrastructure. It's things that we could creatively think of more about PPP and partnerships, while we are neglecting the human index of these other things.
And I think, you know, urgency sells, right? If something is looming before you, everyone reacts. But what counters urgency is planning. And it's not something that we do very well, let's be honest. We don't plan ahead for risks to mitigate the risk. We respond instead. One thing we have gotten right is the Basic Healthcare Provision Fund. So there has been a Basic Healthcare Provision Fund to address the primary healthcare system. We haven't gotten it right, at least there's funding in there, but it's not yet being delivered.
Yeah.
So we need to pay attention to what is our healthcare system and how strong is it today? So that if, as you mentioned, Nancy, earlier, it's not a matter of if, it's a matter of when. Lassa fever comes in, Ebola comes in, cholera comes in. We're not caught flat-footed. We're not caught like shocked. We're actually ready to implement things. So I believe that the primary healthcare system is important. Planning is important. The proactive responses of government, private sector, civil society, the public is very important so that we're not always running kata-kata as boss and now we're responding to the kata-kata.
No, it's not our portion.
Yes. Or insurance.
Yes,
Look at our
or
insurance habits.
yes.
The Lord is my insurance.
Yes.
So we won't plan that something adverse event might happen. How do we plan and mitigate for it? We don't want to think about it. We want to block it out. And that's not how life works, unfortunately.
Yeah.
We do have to plan. And we have to say, if Ebola comes back in again, are we ready? Lassa fever is raging. What are we doing? States still don't have enough. Not every state has enough healthcare labs to test things like cholera, which is a simple thing to test. They have to send it to the center. How long does that take before you respond back? Someone is being infected, still being infected, and spreading this infection. So we really have to think about not just others, but ourselves. I think one of the great things about responding to epidemics is it's not them and us. It happens to all of us.
All of us, yeah.
It's our entire economy. It's our business. It's not their business, my business. When something happens, if 100 people touch that man, imagine if he was in a bus, a cramped bus in the middle of Lagos. People touched him, went home. Everything that
And you
affects
can't
one
trace
person,
them.
it will affect you. So how do we think of our collective good?
You know, in fact, when I know there's an Ebola vaccine.
Yeah.
And I
Yes,
think they
being
call
tested.
it Ebola, or so it's been tested. You know, while I was thinking of this, I was like, I don't know if our country has even thought of, okay, should we also begin to have the vaccine? I don't know, perhaps the NCDC will tell us more about that or more. But you understand, it's talking
Yes.
about planning, just
Yes.
like you're saying.
But I think there is an alliance for emergency epidemic response, which is what the NCDC has built up alongside the private health alliance. So the private sector alliance. So this alliance exists. So we're trying to do exactly that. If Ebola comes in, we're putting things in place. But for that to be complete, we need the private sector.
Yes, and that's my next question, because Seun also touched on it. How should we begin to engage the private sector? Because perhaps is health security a good investment for private sector at this time? Private sector that's inundated with a lot of issues right now. Oh, for our infrastructure development, which you also alluded to, that we can also have some smart ideas or innovative ideas at fixing our infrastructure. Yesterday on the program, I talked about infrastructure. My guests, both of them were like, we can actually have a public-private partnership. You want anything now, you are talking to the likes of Dangote and Co. and all of that. Does it also make smart business case to get private sector also involved, especially in health security and preparedness for the outbreak before the outbreak comes? Because even during the Ebola time, everybody, you see people even had to put, what's it called, sanitizers and all of that. Even private companies started investing in
sanitation.
Yes, in sanitation and in health
Prevention,
security and in
yes.
prevention. So how much sense does it make? And if it does make sense, how should the private sector go about it?
I mean, you know, there's this talk by Dr. Ifeanyi Sofo. It says, if
That's
we...
Epiafric. Yeah,
Epiafric.
it comes on the show.
Yeah,
too.
it says if we don't have health, we have nothing. Yeah, I mean, and it's very important that, you know, there's always that tendency, there's that way you create this orderness around health and education issues, because somehow the gains are not what you feel on a day-by-day basis. I mean, but if you look at public health as a whole, if there's an epidemic, you're talking about something could spread to 1 million people in a second. And I think that's why the private sector has to look at. There's an economic case why security is important for the economic viability of a country. You know, I knew how we did some work around Ebola, and I know how difficult it was to get a flight into Syria alone during the Ebola period. It was really, really hard to find a ticket into Syria alone, because all the airlines deserted, except the A-Sky deserted Syria alone. And so definitely you have to ask yourself, if there's an epidemic and we are not investing in all of this, we are going to be touched by this. And I feel government funding would not be enough. We have too many competing priorities. So there's been the private sector partnering people like NCDC and working to them to how do we set up state-level labs, and you're able to take some form of responsibility to say XYZ Foundation partnering with the state government to make sure that we keep a functional lab in a state. Because in a state, you know, it's even more dear, because now that we're going to increase salaries, and that becomes a bit much more priorities, and people just want to see roads and want to see schools, and they care too little about how you prepare for this kind of spaces. So I feel there's a business case that has to be well explained to everyone, and responsibility there.
In addition to the business case, because the business case is real, sometimes you can't feel it, but it's real. When Ebola happened, we saw it personally. Lassa is happening. People are dying in Nigeria. Are we feeling that personally? Our business is feeling it. Cholera is happening. Our business is feeling it. But I think one of the roles of the private sector, it's its ability to solve problems. You know, one of our shining moments as a nation was how we handled Ebola.
Yeah.
The world over, they're studying how Nigeria handled Ebola. And you know why? Government did its part. Likes of the Dangote Foundation provided salaries for emergency workers for 6 months, donated to the African Union, the Tony Elumelu Foundation, Access Bank, UBA, ARIC, MTN, Airtel, everybody, GSK, people came together. Many more private sectors players came together alongside the government, and we have a world case intervention solution that works. People are taking notes from Nigeria. It's not often that we're the shining star. Usually we're on the bottom of the list for the worst this. We're the best in how we responded to Ebola. It's because the private sector was a part of that, worked alongside government. We know when we come together, we're a lot more powerful, a lot more efficient. That's why even today, as we battle cholera, Lassa fever, Ebola we have a full stop right now, or a comma, it might come back. How are we preparing? We cannot, Seun mentioned, the resources from the government are not enough. That's where we are.
Yeah, because you were even talking about, I think, the Basic Healthcare Provision Fund.
Yes.
Just the NCDC was just giving like 2.5% of it, about 327 million.
Yes.
Naira, not billion.
Yes.
Help. You know, so.
Yes, and the government of Nigeria actually provided about 25% to NCDC's operations in 2018. The 75% came from the likes of the WHO, the US CDC, the German government. The global community came to Nigeria's aid. Where are we? Where's the private sector? How do we support that as well? One day, if the global community decides that they're pulling out, what happens to us? So we need to start building our own support for our own things. And the private sector is a big, big part of that.
Okay, I'm being told we'll soon go for a live event. So whenever they're ready, we can go there. But definitely the conversation is still on. We'll continue to be on air, at least for our international viewers, and we'll record. So for our terrestrial viewers, I promise you would give you the concluding part of this interview next week. In fact, we'll play the whole part next week. So in case they go for the live broadcast. But let's continue, guys. How should private sector come in? You've enumerated, but should they come in through foundations? You understand what I mean? Like CSR, yes, that. Should they just come in through CSRs, or they should be, especially like even pharmaceutical companies, so to speak? Are there other innovative ways where they can come in, especially around funding? It shouldn't just be like, you guys understand.
Yes. I don't think funding is the only thing here, because when we talk about disease control and proactive management of disasters, it's very important. Research is the biggest thing that is underlying it. You want to be able to have people bringing up the knowledge together. There's this, my biggest example, there's this nuclear fission project in the world that has been funded by 35 countries. And so the same countries that don't agree on climate change are coming together to solve a huge energy project. And so that's kind of thinking you want. So everybody's bringing their intellectual expertise at play. And so if pharmaceutical companies and international research companies, and we all bring in our knowledge base together to say, and which is the thing you see with the Ebola vaccine as built right now. There's an Ebola vaccine, and it's just not because just a single element was built in that. People are bringing knowledge, and I think the intellectual capacity that we could is around our country and around private sector, the public sector needs to tap into that. The other part is also not just to do it through foundation. Do it not just as a CSR. Because CSR somehow has been an abused terminology. I mean, but do it as an important part of your business case. As like this is how we survive, because the community that we serve would need to survive. I mean, if you build it as a business case like that, that's how you move forward with it.
And so they must impute, because health is wealth itself.
Yes.
Yeah.
Some concrete examples, right? So supply chains, like a fast-moving consumer good has to supply across the different geopolitical zones, different local governments. How do you ensure that you use your supply chains to support our emergency response? Training, capacity building for emergency response staff. How do we support that process? How does the business, as a core of what they do, lend that service? Whether it's churches that have churches all over, use that as a center for training staff. We really have to think creatively of how we can use what we have. But I think the bottom line is, ignoring it is not an option.
Yeah.
Because it affects all of us.
Yeah.
You know, I know there was a joint evaluation, I think, in 2017, and ministries, departments, agencies came together. They came up with, I think, a funding need of 134 billion naira. When I saw that, I was like, where's this money going to come from? at least for the next 4 years, to implement the plans they came up with. With these solutions that you're talking about, how do you think that perhaps the Nigeria Center for Disease Control, that is the NCDC, can also be supported, strengthened? Because if you take a look at their budget, I think if we have that, guys, let's put it on screen, because we actually had to put their budget, government allocation for outbreaks. The capital budget versus the release 2017 to 2019. 2017, they were budgeted 1.5 billion, 764 billion was released. 2018, 1.6 billion, 624 million was released. 2019, 1.07 billion was budgeted, 209 million was released. So you're seeing a gradual decline of the budget. Are there other, perhaps, some ways that the NCDC can be supported? Because that's one agency of government that is involved with what we're talking about this morning.
I mean, okay.
And I know I've interviewed even the DG of NCDC many times, or at least a few times, Dr. Chikwe Ihekwazu. He's been here. Even sometimes I try to bring issues like this to the fore. That health is wealth, isn't it?
I mean, it's just funding is always the primary thing, and I think I've alluded that we need to properly fund NCDC. And this is not just a discussion at the federal level. I mean, if there are going to be system collapses, it's going to start at the state level, even possibly at the local government level. So, I mean, that's why I come back to my conversations around strengthening primary healthcare systems at the local level, so that you have the right personnel, the right infrastructure, the right kind of knowledge base to be able to analyze or diagnose issues where they come. The second level is also have to be empowering states. So I know NCDC has been doing a whole lot of work engaging state work and state labs and the EOCs, but the most important part is how do you give capacity to the state level work? Because before things come into the federal lab, maybe either in Lagos or in Abuja, things may have gone out of control. And which is something you see around the issues of Lassa fever and the deaths that are related. It's been staggered around the country. But the question you're going to ask is, what exactly is the capacity of the state labs, the state of disease control centers that were supposed to be funded by the state level? No, we talk about the current basic healthcare fund. That's something that the federal government had to plan out. What has the state level government planned out for the state? We have, even the analysis for state, you find states spending less than 5% of their budgets on health. I mean, it's just like, so something has to change gradually around this kind of structure, which is very important. State level capacities needs to increase. And also, secondly, is building the linkages, strengthening the linkages between NCDC and the state level. The thirdly, for me, is funding NCDC to do the work. You know, like Serah said, we can't continue to depend on donor institutions, because sometimes these things are volatile. Sometimes our focus or attention on issues, those things change. And wherever they're changing issues, they're changing to issues around women and girl rights. Those are also equally important issues within the country. And so it's very important that as a government, we put in our own funding into NCDC. As private sector itself, there has to be some form of support. Support from private sector doesn't have to be money, like you said. It could just be something of some of support that makes their work much more smoother and easier.
Okay.